Hello, Namaste. I am Dr. Sagar Javle. I am the inventor of this therapy called Transcranial electrical stimulation of the brain, and I have received a patent for that from the government of India last year, and for another 20 years now, using this device and buying and using this device from a person other than me will be illegal. Please take a note of that. And in this therapy, we are going to discuss the role of this particular therapy uh, in stroke or in paralysis. So please subscribe to this channel, press the bell icon button, press the like button, and make this video viral. Send it to all the concerned patients of paralysis so that they are benefited. So first of all, to understand what is this therapy all about and how to use the machine, there is a very detailed video made and its link is put into the description box below. You should see that video first and then come back to this video to know the role of this therapy for paralysis specifically. So in paralysis, what happens is that the motor cortex, the particular part of the brain which controls the hands and the legs, is damaged. The blood supply is gone because there is a clot formation in the vessel, or there is a hemorrhage, bleeding. That's why the blood supply does not go and that part is damaged. And that part, whichever bodily movements that part controls, those are now affected. So generally it is the opposite. So if this part is damaged, the opposite side body movements are hampered, and this part is damaged, the opposite side. So left to right, right to left, it is opposite. Okay, so there is crossing of nerves in the brain at the level of the eyes, you can say roughly. So this is stroke. That is a problem with the stroke, that this particular part of the brain, the motor cortex, what we call, and the nerves coming down from there, they undergo damage, and that's why the bodily movements hamper. So in stroke patients, what you should do, you should stimulate the motor cortex which is involved, or both the sides, even the healthy one, to keep it healthy, and the opposite side. So in this video we will discuss what is the electrode position. So this is the strapping you have been given. You have to wear it like this for stroke, like this. Wear it like this and place the electrodes like this. These are the electrodes. The black side goes to the head, not the blue side. Okay, so place the electrodes like this. This is first position. Then go laterally. For second session, go like this. So with that, we cover the entire motor cortex. The motor cortex starts from the midline from here and ends just above the ears. Okay, so here and here, that is the position of the electrodes which you can place and stimulate them. Then what should be the duration? It should be 30 minutes to start with, increase by 10 minutes, go up to 90 minutes. Once a day, twice a day is also acceptable, up to 3 months daily, then once or twice a week for a very long time, or could be for the rest of your life also. What frequency to use? Start with 10 cycles per second, 10 hertz. Go to 20, 30. If you go to 40 or 50, that leads to a very intense stimulation. So that is not advisable. You may, if you can bear it, yes. So up to 30 cycles can be used. Then what intensity? Intensity is usually less than 5. Okay, so start with 1, 2, 3, then till the burning sensation comes. It starts burning, reduce intensity by 1 and keep it there. If you use very low intensity just as 1 and 2, the therapy may not work at all. So you increase from 1, slowly go up to 5, 6, 7, till there is burning, till you can bear it. And when it becomes unbearable, then you just reduce it by 1 or 2 and keep it steady over that. Okay, so that is the frequency. So duration I have told, frequency and time. That is how it is to be used in stroke patients. And in case you want to just stimulate the disease side, put the electrode here, this one, and the other side I have given you this attachment, ECG electrode. So one electrode here or here and here, and on the same side shoulder this other electrode which attaches to a ECG, disposable ECG electrode. So this will be the one on the shoulder and this will be on the head under the strap. So this machine is extremely versatile. If you want to stimulate only the disease side, how to know the disease side? It is opposite of what is involved. If you have paralysis on the right side, you have to stimulate the left motor cortex. You have paralysis on the left side, you have to stimulate the right motor cortex. That is how it is. Okay. Then the stroke patients, they also have problems with the speech because Broca's speech areas and Wernicke speech areas are involved. Then you have to stimulate them also. So this is the position for Broca's speech area and this is the position for Wernicke speech area. The details I have given on the website. Okay, so motor cortex and the speech areas. Few people have problems with the vision also, so the visual cortex may have to be stimulated. One electrode here, another ECG electrode as a control here. Okay. And a problem with the balancing, you have to stimulate a small brain cerebellum, 2 electrodes here. So that is all about stroke. How it works? It sends electrical impulses, stimulates the neurons. Neuron makes more pathways and connections with each other. Nerve growth factor and brain derived neurotropic factors are released. They further repair the brain. Okay. So that is the mechanism that I have already discussed in detail in the common video. So I think as far as stroke is concerned and the role of therapy in stroke is concerned, I think we have discussed in detail in this video. Now these patients, they are not ambulatory. You have to carry the paralyzed patient to the hospital every time for the therapy. Because of this machine, what will happen? You can take the therapy at your home itself. Then there is a one-time cost. Running cost is practically zero. You can take 100 sessions, 500 sessions, absolutely no problem. Every time you take a stimulation, the growth factors and cytokines released by the brain could be easily worth 1 lakh rupees by one session of 30 minutes. You can imagine that how much benefit you are getting. The growth factors and cytokines released by the brain are the best medicines. But you cannot take it from outside because they don't cross the blood-brain barrier. They don't reach the brain basically when you take it from the mouth or from your vein. That's why this particular therapy is so important. So continue your existing treatment. I am not telling you to stop the drugs. Take the doctor in confidence. Plus try this therapy. When there are benefits, then reduce the dose of the medicines. Maybe some few people may be able to stop taking the medicines. We don't know. But that disclaimer I am giving, that don't stop the medicines without consulting your doctor or without consulting me. So I think in this video we have discussed enough. In the description box below there is my personal number, email address, WhatsApp number, website. On the order page of the website you can order the device. Device can be shipped only in India for the time being. And go through all the videos and the website material, and still you don't understand, then only contact me on my personal number, because I have given you the personal number. Please don't misuse that. Plus, moment you have a benefit, please record a video and send it. With your permission we can put on the website, so that other patients also have encouragement. So that's all for this video. Thank you very much.